General principles: the use of electrocautery intraoperatively can have adverse effects on the function of implanted cardiac devices. A variety of errors can occur, from resetting the device to inadvertent discharge of an ICD. Complications are rare but are more likely with abdominal and thoracic surgeries. The type of device, i.e., pacemaker or ICD, and manufacturer should be determined along with initial indication for placement and the patient's underlying rhythm. History and ECG review should suffice. The device should be interrogated within 3 to 6 months of a significant surgical procedure. Treatment: if the patient is pacemaker dependent, the device should be reprogrammed to an asynchronous mode, e.g., VOO, due for the surgery. The application of a magnet will cause most pacemakers to revert to an asynchronous https://trunktam2oc.com/pacing mode. However, if this is the planned management, it should be tested preoperatively, especially in the pacemaker-dependent patient. It should be noted that the effect of a magnet on ICDs is typically different from the effect on pacemakers in that it affects the antitachycardia function but does not alter the pacing function of most models. If the pacing function of an ICD needs to be altered perioperatively, the device will need to be reprogrammed. The antitachycardia function of an ICD will typically need to be programmed off for surgical procedures in which electrocautery may cause interference with device function, leading to the potential for unintentional discharge. The effect of a magnet on this function is variable, so programming is the preferred management. Continuous monitoring for arrhythmia is essential during the period when this function is suspended. Post-operative interrogation may be necessary, particularly if the device settings were changed perioperatively or if the patient is pacemaker dependent. Consultation with an electrophysiologist is strongly recommended if there is any uncertainty regarding the perioperative management of a device.